Welcome to Psych Talk for primary care providers, where our esteemed faculty members will provide you with invaluable insights to seamlessly integrate into your daily practice. Today, we have Dr. Glen Xiong, who takes us through a popular case study. He teaches us how to use cognitive behavioral therapy to help patients.
Hello there, my name's Glen Xiong. I am an internist psychiatrist with TNT, Primary Care. So what I'm going to do is I'm going to cover a case that was actually discussed in our August 2023 conference. This is case number 3. Some of you may remember this. This is the case of a 63-year-old man with depression and anxiety for about 1 year following retirement as a US Postal Branch supervisor. He's not had any manic or psychotic symptoms. He was started on an SSRI, and after about a good course of treatment, about 2 to 3 months, he's only had less than 10% improvement. And upon interview, these are a couple of his statements. I really miss being with my coworkers and supervising them while at a great branch. I also feel a sense of lost with not getting up each day for a full-time job. It is different and hard to adjust to. What this case illustrates you can even consider this as a case of treatment-resistant depression. Now, I was walking around and helping out some of the small groups in the sense that how do we apply cognitive behavioral therapy for this patient? So as it turned out, and to my surprise, quite a few of the group members thought that the cognitions that this gentleman was having, they were normal, in a sense that he is going through something that is reasonable, given that he retired, he no longer has a job. Of course, he's feeling a little depressed. Now, I have to challenge that a little bit as a person who takes care of older adults, in that he is only 63 years old. I've asked some of the group members, what if he still has about another 30 years? What if he lives till 93 or 100 years old? So clearly, in my opinion, there's some dysfunctional thoughts, okay? Another common thought process of our older adults, especially those folks who are retired, is my kids are busy, they have their own kids, they have their own lives, they don't really need me. So what is the point of living? And as you can imagine, in fact, you often get into a situation an older adult has passive suicidal ideation. They really don't see that their life is valuable. So let's apply CBT. So what I like to do is I always like to divide up the CBT into C, the cognitive therapy, and then B, the behavioral therapy. So first, let's talk about cognitive therapy. Dysfunctional thought records. So here are some of his dysfunctional thought records. I cannot work. I am useless. I have no purpose in life now that I'm retired. If you talk to him a little bit more, then other thoughts could be, if I don't have anything to contribute to society, I am worthless. As a general rule, most dysfunctional thought records or dysfunctional thought patterns have a core belief. So there's actually just 2 most important core beliefs that drive most dysfunctional thoughts. The first one is related to self-esteem. It generally comes to the sense of, I am not good enough. I am worthless. So those are fairly similar. And in fact, you can apply that to a lot of conditions, whether they're depressive disorders or anxiety disorders, especially anxiety disorders for folks with perfectionistic thinking. The second core belief is interpersonal. Nobody likes me. My kids don't like me. That person didn't pay attention to me. So those are the 2 most important core beliefs. Again, number 1 is I am not good enough. Second one is nobody likes me. So let's talk about intervention. So as it turns out for this case, you can take a look at his thought records and realize that one pattern that we're seeing is something called all or none thinking. All or none thinking, also known as black and white thinking, is basically if I don't have X, I don't have anything. There's no consideration for alternatives. How do you intervene from a cognitive therapy perspective? Notice that we're only talking about cognitive therapy. So one way you can look at this is something called cognitive restructuring or reframing. You may say something like this. Okay, so do you think you have some skills? It sounds like you have some skills that are quite valuable in terms of supervising other people. Patient might say, yeah, you're right. I do have some skills. Now that you think of it, maybe I can't work in the postal office, but I wonder if I can apply my supervisory skills elsewhere in life. It may be something that's equivalent to the previous job. It may be something similar. The individual, though, has to find something that is worthwhile. So I would not work on trying to push on a specific job to them, but to help them and guide them into figuring out how they can apply their skills. So that's intervention number one, is cognitive restructuring. The second one is role play. The easiest way to conduct role play is pretend that you are that patient and say, hey, pretend I am you or I am your friend. What would you say to me if I'm in your situation? And pretty soon, what happens is you're helping the person step out of their situation. They may say something like, wow, my friend who's 63 years old, he's pretty young. He's got quite a bit more to do with his life. And then so forth and so on, you would act out the role play. And I think role plays are actually very, very fun and a great way to know your patients. So we just finished about cognitive therapy. Behavioral therapy. So what I like about behavioral therapy is something called behavioral activation. So let's say that this person doesn't really want to talk. It's way too much work to think about cognitive restructuring. The person is quite resistant. You can just drop the cognitive therapy and jump right into behavioral therapy. So recall that in insomnia, you can understand about all the reasons why you can't go to sleep, but behavioral activation or behavioral therapy is where it's at. So this is the BT. So you may something like this in behavioral therapy. So it sounds like what is important for you is to be useful. You believe that you are no longer useful. However, what do you think about the following options to apply your skills? Would you consider just a job? I know what you had was a really important job, but would you consider something else? Are there jobs that you've always wanted to do that you would like to give it a try? And you explore and try to help the person find one. A job could be a volunteering possibility. Another one could be, what happens when people retire is they lose a sense of self-worth, and because of that, they have a hard time finding enjoyment. So helping the person find things that they like to do, it could be volunteering, it could be a hobby, or it could actually be, say, why don't you go take a 6-month vacation that you've always wanted? After that, go out of retirement, right? So those are all different options. Finally, what about helping your kids or grandkids and spending some time with them? I know they're gonna not want you maybe, but maybe not. I can't imagine any family with kids who does not need help. Now, certainly you have to zip and not talk too much as a parent, but there are plenty of things you can do. With that in mind, I just wanted to summarize. CBT has 2 components, cognitive therapy and behavioral therapy, and you get to pick what you want to use depending on where your patient's at.